Hi, I am Dr. Anil, consultant neurologist at Columbia Hospital, Hebbal. The management of the stroke involves in the acute management and the long-term management. In the acute setup, like where a patient comes to us, we see what type of stroke it is. Whether the stroke has occurred because of the blockage of the vessel or it's because of the bleeding into the brain. If it's because of the blockage of the vessel and if the patient has come to us within 4 to 5 hours, within the onset of symptoms, we can give the clot bursting mechanism, or we can give that injection which can burst the clot, reperfuse the brain, and the outcomes are better. In the longer term, we need to find out why the person had a stroke, what are the risk factors, rectify the risk factors and treat accordingly. For example, if the patient had high blood sugar, you need to get the sugar into control, high blood pressure into control, high cholesterol, give the appropriate medications. If he has an associated heart condition, treat it. In a heart rhythm disturbances, treat it. And once he is discharged, we should advise him a good physiotherapy, and if his hand is involved, good occupational therapy and the other good rehabilitation measures which will improve the outcome. There are a lot of developments in the treatment of stroke of late. As I told you, we can administer IV drug. There's an injection which you put in a small glucose bottle and we infuse, where it can burst the clot and reperfuse the brain. The blood flow can be restored. Or we can pass a catheter, or we can suck or pull out the clot which is there in the blood vessel, which improves in the blood flow to the brain. One. Second, we give medications for further prevention of the clot to occur. We find out why the clot occurred in the first place and treat those so that he doesn't have a clot again and again and stroke again and again. And we also involve the rehab team earlier in the process where the outcomes are better.